My name's Sydney. I'm a labor and delivery nurse, and let's talk about cord blood banking. Cord blood banking is a program that you can choose to do. So it's not mandatory. It's something that you pay for out of your own pocket. There are certain programs that offer donation. This is something that you'll have to bring up with your care provider during your pregnancy because this needs to be organized ahead of time. Basically, cord blood banking is when we take the cord blood that's left in your baby's umbilical cord and we collect it and we store it. So all of this blood is really, really rich in stem cells, and stem cells are used in a lot of different medical research. It's used to cure lots of diseases, and the research for this is just continuing to grow. So this cord blood with the stem cells can be stored and used for your child in the future, or potentially a family member as well. Some conditions that are currently being used for treatment with this are aplastic anemia, leukemias, lymphomas, severe combined immunodeficiency disorders, sickle cell disease, and beta thalassemia major. And then there's lots of other diseases that are currently in clinical trials. For example, type 1 diabetes, cardiovascular disease, cerebral palsy, autism, strokes, osteoarthritis, rheumatoid arthritis, and multiple sclerosis. There's lots of different companies that offer this, so make sure you do your research and figure out exactly which company you want to go with. To give you an example of the costs of what the one that I work with at my hospital has an initial first year payment of $1,278. That's for the processing and storage fee. And then the second year onwards, you have to pay a storage fee of $153 per year. I think if you have the means to do it, definitely go for it, because this is something that you hope you will never need to use, but you will thank yourself if you have collected your baby's stem cells and you actually need it. And it doesn't cause the baby any pain or anything to actually take the stem cells. You're not taking any blood from the actual baby. It's just whatever's left in the umbilical cord. That's what you're taking and storing. Something to keep in mind is that when you're in hospital, you're gonna have your blood taken and sent with the cord blood. You're also not going to be able to do delayed cord clamping, and this is because it gives you the longest opportunity to collect the most amount of blood. If you want to do delayed cord clamping, I recommend only doing about 30 seconds, and then they can clamp the cord and actually get all that rest of that blood collected for the cord blood banking program. If you do 2 minutes of delayed cord clamping, you're going to get a terrible sample and it's going to just be a waste of your money. If this is something that you're interested in, make sure you talk to your doctor ahead of time and they can organize which kind of companies they work with. Sometimes there's discounts that you can also get through your OBGYN or midwife, so make sure you talk to them.